Survive Outdoors, we're back on a blustery, cold, late October day. So I wanted to tell you an update again. We have that giveaway we're giving away on November 11th, Swiss Army knife trekker and the trekking poles. That's going to be coming up. I'll put the link in the discussion below to the video. On that video, you got to subscribe. Make a comment. Do you want more wilderness medicine, more gear reviews, or more survival? And you get an extra entry if you like our Instagram page at survive.outdoors. All right, we are going to talk about what medication should you bring along, take with you on a 7+ day excursion / expedition trip. That would include Mount Everest, the extreme of the extreme, or you're going out to Colorado and you're going to hike in Rocky Mountain National Park for 7, 10, 12 days, or you're just going to the Smokies for a while, or even you're through hikers. These are some ideas, things that would make your life more comfortable and being prepared. So here we go. Well, I've done a couple of these physical exams for people that are going out to Mount Everest or they're going on an expedition somewhere overseas. And let me tell you, it's absolutely atrocious of what they ask for. It amazes me. A Boy Scout physical is more involved than a physical exam for one of these long expeditions. If you look at some of these companies, which will remain nameless, you can Google them and look them up. If you have a resting pulse of less than 100, you're in. That's like their main criteria. And the physical exams are really base. Just as long as you have the $30,000 to $40,000 cash, approximately what it's going to take to hike up Mount Everest. Last year, I think they had 11 deaths. So be aware of that. That's really important to look at. If you're traveling overseas, it's really important to find a healthcare provider who is an expert in travel medicine. And if you go to the CDC, you'll look at what country you're going to and you'll see the list of vaccinations that you need to have, whether it's Africa on a safari for photography or if it's Mount Everest, wherever, and you will see the vaccine. Some countries are adamant you have to have a rabies vaccine. They won't even let you in if you don't show proof of that. Most of your county health departments do an awesome job with this, so check with your county health department. Most urgent cares, we don't have all the vaccines that you would need. So we have hepatitis B and tetanus, obviously, and a few others. So when you're traveling, that's really important. Also, at the end of this video, I'm going to attach the video we discussed about getting fit in the outdoors. Some of that is very relevant here. So you need your regular meds divvied up for the amount of days you're going to be gone. So whatever medication you're taking, is it cholesterol meds, high blood pressure, diabetes, whatever that might be. So that's obviously very important to have that along with you. Hopefully some of your meds they don't have to be refrigerated. If they do, there is a way around that. They make small little packs that you can put your meds in and they will stay cold for quite a bit of time. Not 7 days, so that's something you need to talk to your healthcare provider about in terms of how to get around that. So think about that. Skin, largest organ of your body, so the skin. I recommend definitely taking a steroid cream, Vaseline, moisturizer, and chapstick. So those three are really important. Eyes, extra pair of glasses, extra pair of contacts. If you have a monthly or if you have daily, clearly it's a no-brainer, you bring your dailies. But an extra pair of corrective lenses are really important. Dental. If you're going to be gone for 2 weeks, you need to have a dental check. Dental pain, besides burns, are the worst. So get a dental checkup before you're gone. Make sure that you don't need a root canal or you got some tooth that's pretty fragile. That's important. Respiratory. So I always advise people to take along an antibiotic that's pretty broad spectrum For example, doxycycline is an excellent antibiotic for respiratory issues, community-acquired pneumonia, helps with sinus infections, also good for skin infections. Covers gram-negative and gram-positive, and I'm going to show you a little diagram here how awesome it is. If you're allergic to doxycycline, then you got to think of an alternative, something that's broad spectrum, because you don't want to be bogged down with tons of meds. If for respiratory, asthma, bring your inhalers, bring your antihistamines, really important. We talked about bee stings, Benadryl and Pepcid AC, a histamine 1 blocker and a histamine 2 blocker. Really, really important to bring those along. Headaches, ibuprofen, Tylenol. If you have a history of migraines, really important to bring your migraine medication with you, Emitrex, whatever you're taking. So that's important. If you're going to be climbing above 5,000 feet, I have written tons of scripts for Diamox, and that is really good for, it's used for glaucoma patients to decrease pressure, and it definitely is helpful in high altitude sickness. So Diamox, I've taken it when I've been about 8,000 feet. It works really good. A lot of your symptoms like how high altitude pulmonary edema and some of the serious issues with altitude, that really doesn't usually occur until about 10,000 feet. But remember, you start getting symptomatic, stop where you're at, take your meds. If it gets worse, you're going to have to decrease in altitude by 3,000 feet. And that would help a lot. Stomach issues, bring some Tums, bring some antacids, make your life a little comfortable with that. Imodium and Lomotil. Lomotil is a prescription. You got a plan for traveler's diarrhea. It also depends on where you're going to be. If you have bloody diarrhea, as a rule of thumb, do not take Imodium. Do not take any anti-motility drugs like that. I also recommend taking like a quinolone, like Cipro, with you, or you can even take Bactrim, which is a sulfa drug, and those are really helpful for your traveler's diarrhea. Now, a lot of traveler's diarrhea will dissipate. You don't need to take anything. Also bring some Pepto-Bismol, but be aware, Pepto-Bismol has aspirin, salicylate in it, so be aware of that. It has aspirin. If you have allergies to aspirin, you're not going to be taking the Pepto-Bismol. So that's important. But urinary tract infections, intestinal issues, it's always helpful to have those meds on the trip. So your 3 antibiotics that I'm advising are a broad spectrum for respiratory issues and skin infections, especially if you get cut. The other thing that I'm really recommending is like a Cipro or a Bactrim or sulfa drug to carry on with the trip to deal with those organisms. Feet. So one of the most important parts of our body in terms of especially your hiking and backpacking, leukotape, kinesiology tape is really helpful to alleviate any blisters. We have a whole video on how to use that, and I'll attach that at the end of this video. So that's going to make your life a lot more comfortable also. The other medication that I advise is prednisone. The cure-all of meds, right? So in sharp bursts, it's extremely safe, very helpful for respiratory issues. You're around a campfire, excellent for allergic reactions, a skin dermatitis, poison ivy, absolutely awesome for aches and pains, musculoskeletal issues. So that's really helpful. So I always bring some prednisone along, and again, so there's only like 3 or 4 bottles of meds, and you can combine those in as long as you know which meds are which. You don't have to be overpacking. It sounds like it's a lot, and it really isn't. If you have a history of allergies to bee stings, wasp stings, EpiPen, remember we talked about that? That's really important. Please make sure you have that. You die from severe allergic reactions, you need your EpiPen. Bandages on 7 to 14 day trips, you're going to have some way for closure. So whether that's duct tape, and we showed you how to close a wound with duct tape, or whether that's staples, so you're definitely going to need that on a 7 to 14 day trip. These are the times that I do bring a tourniquet. because you don't know if something serious is going to occur. So absolutely, on these trips, I would bring a tourniquet. Something else, be advised, there are a lot of family practice docs, family practice PAs and NPs that are hesitant to write you out a script for all of this on a trip. I have no problem. However, I have also been conned in the past. So I have recommendations, and what I want to see is I need to see some type of travel voucher, some type of evidence that they're going to be gone, or you're going to be gone to, you know, the Rocky Mountains for 2 weeks, or you're going to be going overseas to South Africa on a safari. I need something to validate, and then I have no problem of writing you out your scripts for your trip, and then go to the health department and get your vaccines. So because I'm in the field of medicine, I would usually carry also aspirin. God forbid somebody in the party has chest pain. I would carry nifedipine, which the brand name would like a Procardia, to drop a blood pressure if I have someone in severe issues with their heart. These are things you're not going to carry, and nitro. I would always carry a little bottle of nitro. So those are the things for my medical personnel that I would advise that you carry if you're in a group of people and you're heading out. That is it. What meds should you have on you for a 7 to 14 day trip? If you like it, give me a thumbs up, subscribe, hit the bell, that would be awesome. And don't forget, November 11th, we're giving away the Swiss Army knife and the trekking poles. Keep your eyes on the horizon, your face to the wind, stay safe.